Patient walked into my clinic held by two relatives. His creatinine was high, he was a diabetic, and he had a low serum albumin. He had swollen feet, which was both due to the renal failure, both due to the kidney affection, and also due to the hypoalbuminemia, malnutrition. So then I prescribed him a higher protein diet compared to other kidney patients. Around 1 to 2 months later on, when the patient came back to the OPD, he came walking as a bright person rather than a sick person. I am Dr. Sandip Prabhakar Bhurke. I am a practicing nephrologist, consultant nephrologist and kidney transplant physician at Andheri and Borivali in Mumbai, Maharashtra, India. Diabetic kidney disease diet. Is there a diet like that? Actually, no. Usually, there are three types of diet. One is the diabetic diet for diabetes mellitus sugar patients. One is the salt restricted diet for hypertensive blood pressure patients. And third is the renal diet for CKD, chronic kidney disease patients. So, a patient who is having both diabetes and chronic kidney disease will be given something which is a combination of the two, DD, RD. So, DD and RD will be diabetic diet and chronic kidney disease renal diet together. So we will come to the components of this. In a diabetic diet, the carbohydrates are the ones which are adjusted as per the patient's requirements. The ones with a glycemic index which cause the sugar to rise up very fast, like pure sugar, refined sugar, then breads, rice, and potatoes will be the ones which will be reduced in the diet, and complex carbohydrates like the other carbohydrates will be continued. You cannot starve the patient, so some carbohydrate has to be given. And in fact, if the patient is on the lower side of sugar hypoglycemic, then you will give purer sugars and more carbohydrates to the patient to maintain the sugar level of the patient. The patient who is diabetic with a high creatinine, which means he has gone into chronic kidney disease most of the times actually, in such patients you will give the renal diet. In the renal diet, there will be usually a protein restriction. So the normal person is given 1 gram per kilogram per day of proteins with 50% of high biological value. But in a chronic kidney disease patient, you will give them 0.8 gram per kilogram per day of protein. While those who are according financially, we will be giving them a low protein diet, very low protein diet with alpha keto analog supplements and protein kidney special supplements powders to these patients. The other aspect of the renal diet would be the potassium. If the potassium is on the higher side, in such patients, we will reduce the amount of coconut, dry fruits, and other potassium containing medicines, including potassium syrups and diuretics, which can cause the potassium to go high. The other aspect is phosphorus. If the phosphorus is very high, then you will have to reduce the intake of non-vegetarian food and dairy products. Finally, we come to the water intake. If the patient is having swelling of the feet, breathlessness episodes, then the water intake is reduced. While if the patient is dehydrated, then water can be given in adequate quantities up to 2 liters per day. Foods to be avoided in diabetic kidney disease. What not to eat? First and foremost, salt. The salt has to be restricted so that the water is reduced in the body and the blood pressure is reduced in the body. The second is the potassium. So any type of coconut or dry fruits or other such things which have a high potassium content are reduced. The patient is also told to reduce the refined carbohydrate intake so that the sugars are controlled. In such patients, we can give them millets, but we will reduce the amount of rice which is being given to the patients. In patients with diabetic kidney disease, you will reduce the protein intake and you will tell them to take higher quality of high biological value proteins, but dals which are a lower biological value are reduced. In such patients, we will also tell them to reduce or completely stop smoking and alcohol. Patient walked into my clinic held by two relatives. He was told to be comfortable on the bed, and then I examined him. He was fully cachexic, malnourished, and loss of muscle mass. So in this case, I saw his reports. His creatinine was high, he was a diabetic, and he had a low serum albumin. He had swollen feet, which was both due to the renal failure, both due to the kidney affection, and also due to the hypoalbuminemia, malnutrition. So then I counseled the relatives that this patient, even though having CKD, chronic kidney disease, needs a higher nutrition. Renal diet, as we say it, where there is a protein restriction, is not applicable to this patient because he is already malnourished and he requires weight increase, muscle mass increase, and healthy body. He doesn't need a malnourished body. So then I prescribed him a higher protein diet compared to other kidney patients, and that included protein supplementation. And because he was vegetarian, I asked him to take paneer, soybean, and mushroom. Paneer is the Indian equivalent of cottage cheese. Around 1 to 2 months later on, when the patient came back to the OPD, he came walking as a bright person rather than a sick person. Of course, his creatinine had risen a little because of the protein intake, but then his swelling of the feet had gone down, his weight had gone down, and his muscular mass had improved. So that means that he was healthier rather than sicker. So that is a trade off between the creatinine and health. The diet to a patient who is a diabetic kidney disease is prescribed by the renal dietitian, who will adjust the diabetic diet, salt restricted diet, and the renal diet as per the reports and the prescription of the nephrologist. There is usually a variety of diet which is given rather than a monotonous daily same diet, and also a little fluctuations in the diet is permissible so that the patient does not get bored of eating the same types of food daily. Finally, the patient has to enjoy his diet and not feel like a criminal who has been given something which is unpalatable. Thank you. So if you have any more questions about any medical topic or surgical topic, you can write in the comments below and I will answer them as soon as possible. Thank you. If you are not subscribed to my channel, kindly subscribe. Thank you.